Now we have to make sure that we assess and then we interpret the growth and see what we have to do. So as I said earlier also, from birth, which we can measure, is the critical window period till 2 years of life, which in order to promote optimal health, we have to make sure that they are growing very well during that period. So one of the best way we can find out whether they are getting the optimum nutrition or not is whether they are on getting regular by doing regular growth monitoring, and then see whether they are these two documents are there for each gender, and how long can we use this? Anybody quickly? Well, we can use it till about 18 to 19 years because the charts are available till 19 years. And it is important that you tell them after 5 years also to continue using this book, because that will provide a lot of information about the growth. So how do you assess growth? Now, growth is actually, as we learn, it is a physical development of the body. So it can increase in different directions. So the weight, height, mid-arm circumference, skinfold thickness, occipitofrontal circumference, and use in the day-to-day clinical practice, and which will provide some important information from the clinical perspective. Now, weight measurement, we have two types of balances, the spring balance and the beam balance. Now, the spring balance means a spring is there. Either you press the spring or compress the spring and get the reading. So it can be a bathroom scale, it can be a hanging balance, or the gauge will move. But these all, of course, depends on the tension of the spring. So the changes in the spring tension will affect that. Now, on the other hand, the platform type and the cradle type are there, which is better because it will not depend on a tension of a spring, but the balancing of the levers. So the levers will hardly get wear and tear. So the accuracy of them and the long-term durability or the long-term accuracy of these instruments are much better. But whatever instrument you use, you have to use standard weights, and once in 2 weeks, or depending on the time period you use, you have to calibrate that and see whether 1 kilogram is giving 1 kilogram. So you have the standard weight and put it, because if a child is put on the balance, whatever measurement you give, you take, okay, it is right. And even if the last time, 1 month ago, measurement was 7 kilos, today when you measure it is 6.9 or 7.1, you don't know it's either 1 kilo or 2 kilos. You keep it at the beginning of the day, see whether it is correctly measuring. So like that. Similarly, this, of course, you have to make sure that when you bring it to 0, there is this bar will be moving up and down, and it should be on the neutral position. So that way, to great extent, you can bring it and see, but then you can put again a standard weight and see whether it will accurately measure. So that is for weight. Also, sometimes some children will be very disturbing and they cannot be put on either way to measure. So then you ask the mother to stand on the weighing scale. You take the weight, give the baby to the mother, and then you take that weight. So baby plus mother weight, you reduce the mother's weight, and then you will get it. So the height measurement, length less than 2 years, you call it infantometer. Height, you can call it more than 2 years for using the stadiometer. So this is a stadiometer where a person will stand against that, and when you have to adopt the correct technique, the heel, then the buttocks, back of chest, and the occipit should be touching this vertical plane. The calves may touch, may not. So, but of course, if you can touch it, it's better. But these four places, the heel, buttocks, back of chest, and the heel occiput should be touching the vertical plane. The child should be looking straight. That is what is called the Frankfurt plane. That is the lower margin of the eye orbit. You can feel the orbital cavity, and then the external auditory meatus should be in the same horizontal line. So that makes the person looking straight. And then you bring the head part and keep it to crush the hair, because you should not leave room for hair. You have try to bring it as low as possible and touch the scalp if possible, and that would be the height. So this way you can see the heel, back of chest, back of the buttocks, back of chest and occiput is touching, and then the calves also can touch, and this will be brought straight onto the hair, and without any wearing footwear or putting on. The girls will have a lot of hair dressing, those have to be removed. So similarly, you take the child to the horizontal position and then you measure. So you keep same the occiput, back of chest, buttocks, and the heel in the horizontal surface, and then get it this way, measure. So that is, and then the horizontal, not horizontal plane, but in a vertical plane, you keep the eyes, so which is the head, which is again the same Frankfurt plane, where the low margin of the orbit and then the external auditory meatus are in the same vertical plane. So for the length measurement, it is the vertical plane. Height measurement, it is kept in the horizontal plane. So these are the boards which you can use, or you can use a simple mat. Then the mid upper arm circumference, you will measure the midpoint between the acromion and the olecranon process, the olecranon and the acromion process. You take the measure, you keep the hand flexed and get the midpoint, and then when measuring, you keep the hand extended, because if you flex, the bicep muscle will be prominent and there will be a lot of tightening and increase length. So what have to be done is that you extend the arm and then measure, where you keep it adequately crushed and get the measurement reading. So for that, there is a special tape also called Shakir tape, where you can put this end here, and usually more than 12.5 is considered normal, less than 11.5 considered as abnormal, anything between that will be considered as alarming. So that's why in the Shakir tape you have this is, if they circulate and then this red part comes here, that means it is less than 11.5. If the yellow part is here, it is between 11.5 and 12.5. If there is green, then that means it is fairly okay. So this is actually used for rapid screening in 1 year to 5 year old children, because during that age period, the mid upper arm circumference does not change very much. Then other thing is the skin fold thickness, that is a double layer of the skin which will be measured with the underlying subcutaneous fat. So it is actually a double thickness of that, but that will give a certain amount of information about the fat deposition in the body. So there will be skin calipers, but is a common one is Harpender caliper. You move it here, then the teeth opens, you keep it, hold it for about 2-3 seconds, and you get the reading here. So that way you can measure the skin fold thickness. Usually there are other calipers also, Tanner Whitehouse caliper, more or less all work in the same mechanism. So we have main places. One thing is the suprailiac, we have the triceps, and then in front we have the biceps in this level, or we can have the subscapula. So the subscapula and the suprailiac are called the central skin fold thicknesses, whereas the tricep and then the bicep is called as the peripheral skin fold thicknesses. So those will give some idea about what we are measuring. Then the occipital frontal circumference, you measure just above the eyebrows, just above the the ear, the pinna, and also going behind the occipital protuberance. So at that level, horizontally you measure and you get the measurement where you will get it as the occipital frontal circumference. So if a child is smiling and staying like this, it's very nice, but you have to be very patient and also do it very fast. Then one of the most important or coming up prominent measurements is the waist circumference, where you measure the waist, because especially in old age adult, you can take this as an indirect measure of obesity. And where do you get it? You go to the mid axillary line and then come down. You get the lowest point of the rib cage or the costal margin, and then same way you come and you will find the highest point of the iliac crest. So in between this process, this place will be empty. So in that place, you can measure horizontal. So both sides you get that. So the lowest part of the costal margin, highest part of the iliac crest, and then get the midpoint, and then horizontally measure. It is not the level of the umbilicus, because umbilicus is a position that is there in the skin and it can fluctuate. So that has to be stopped, and that's why you have to get it into the horizontal. So you get the bony surfaces, and then the bony surfaces does not fluctuate, and in relation to the bony surfaces you will mark this. So in adults, of course, if it is more than 19 males and more than 18 females, it's considered as bad. But the easiest way is that you can take it in relation to the height, which we will discuss later. So we have made the measurements: height, weight, or length, weight, occipital frontal circumference, waist circumference, mid upper arm circumference, and then the skin fold thicknesses. So those are the measurements what we take. Now once we take the measurement, if they are there, sometimes it will not give much meaning. So you have to either convert it into an index and see, or you may have to use other charts for interpretation. So here the body mass index is where the weight in kilograms divided by the height in meters, you can get a value for this. Or you can also use a nomogram and easily do that also. Now, for example, if it is 140 centimeter tall person with a weight of 40 kilograms, you mark on these 2 points and then see where it crosses the center line, which is about 21 or so BMI point. So it is that way. So in the field, you can use this, and this chart is also available in the CHDR. So you can get this measurement done quickly. Now the other thing is, as I told earlier, waist to height ratio or waist circumference to height ratio, which is gaining popularity now. Very simple. You just have to have a tailor's tape, which is about 20 rupees. You stand against the wall, mark your height, and then measure the height. Then you measure the waist circumference, as I told you. Divide the waist circumference in centimeters by the height in centimeters. And if it is less than 0.5, it is normal. If it is more than 0.5, then it is actually abdominal obesity, which is the more detrimental part, especially in the South Asia region. In my next lectures, I will tell you how obesity has caused problems that you can find out. So this is a very, very easy screening tool. Even now, we have taught the school children, grade 6 onwards, to use this as a measure of obesity. Any questions up to now? Anything? So once you have done the measurements, now you will get various values. So they will be meaning less unless you see whether that is normal, abnormal, high, low, and then decide on what should be done. So the evaluation takes place, should determine whether they are normal or abnormal growth occurring. Then we have to use cutoff values to say this. And what is being done is we compare with the population and see whether these individuals are normal or not. So the SD chart, standard deviation charts, can be used for that. Now, as I told earlier also, there are two types, the distance chart and the velocity chart. The distance chart will give from birth or whatever measuring starting point, what has happened over the period up to now. So there will be collectively keep on accumulating. So the height grew from 50 centimeters, 75, 100, 105, 110, like that. It will keep on going with age. But the velocity chart is per year of age or per unit time of growth, time period, how much this person grew. So between 4 to 5 years, they are given 7 centimeters, like that. So if you measure at beginning of 4 years and then measure at beginning of 5 years, you can take the median, you can divide it by 1, and then you can see, okay, it is 7 years. So then 7 centimeters. So you mark it actually between the two, because you don't know at what point, because this growth velocity actually does not happen uniformly throughout that particular period. Now, if you take from January 1st to December 31st, throughout that year, every month he did not gain a particular amount. There would have been some periods the rate would have been better. Some periods the rate would have been less. So then ultimately the mean had been whatever 7 or 6 or 10 or whatever centimeters. So it will not be a uniform rate of growth that is taking place, but different depending on the seasonality. If there is a less infection season, they will gain well. If there is poor infection season, there is a lot of infection, poor nutrition, famine or something like that, then there will be poor growth. Now in Sri Lanka, of course, we don't see that much of seasonality throughout the year. We see food and everything, but in certain countries like in the African continent and all, you see the seasonality. So the availability of food will also be different. So if you break this 1 year and try to make a plot, there will be some things like this. So you have to, So because to overcome that, when we are marking, we mark at the center for the period. So there had been a lot of charts developed in the past, but you have to forget all these charts. This is for historical purpose I put. And what we use is the 2006 WHO, 2006 and 2007 WHO growth charts, which are the ones which are available in the CHDR or the Child Health Development Record. Now, if you go on, I don't want to actually take a lot of time on this. These are the original charts made by the WHO. It is actually came from 6 countries' data and then went on, they compiled, they made these charts. So we have taken the data from this and then prepared the charts in this growth chart. So you can see we have charts from birth, the weight for age chart. First one is from birth to 2 years, then 2 years to 5 years. And these actually, the measurements should be monthly, ideally up to 2 years, but at least till 1 year you can make the measurements monthly. Then the second year at least 2 monthly. Thereafter also ideally 2 monthly, but at least make sure that once in 3 months they have measured the weight and plotted. Now there is no point of just measuring the weight. They have to be always plotted. So if you are actually very familiar using the growth charts, within 10-15 seconds you can plot the chart. So it is not a very time consuming. And I want you all to remember everything in these charts because it's very important that you use them very frequently. And all your assessment should be based on these set of charts. Then the length or height, you can see that, of course, in the first year you can measure every 3 months because the rate of gain in the first year is about 25 centimeters. You will appreciate But subsequently, measuring once in 6 months, adequate amount of length gain uh, for you to appreciate a difference. So it is, and the parents will also get alarm unnecessary. So you get that. So once you, for the old age, you have the uh, height chart from 5 years up to 19 years. Again, here also once in 6 months, if you can measure and plot, that would be better. Then for older children, you have the BMI. So you don't have a weight chart because there is no point of weight measuring, weight recording, because weight is, of course, is a composite thing where weight does not differentiate whether somebody gains in length or puts on fat. But what we want and what we are interested is in seeing whether the person is in proportion, whether there is a proper way to match the height of the individual. So for that, you have to make this BMI in older children and younger children. You have to use the weight. So so somebody who is thin but very tall can have a normal weight. Similarly, somebody who is short and having a weight, obese, can have a normal weight in the weight for age chart. But when you look at his height, his weight in relation to the height, the short fat fellow will be obese actually. The thin tall person, although he is having a normal weight, he is actually very wasted or thin because he can have more fat and more muscles and put on a better body composition. So he has not gained that. He has just gone tall and thin. So because of that, you have to correct all that and get it done. So it is important that you do that way. Then this is the weight for length chart. So as much as you measure the weight in the small child, and then the length, you have to plot it here and see whether the child is growing correctly. But if not so, then you have to intervene. So always remember this chart also should update because this is the chart which gives the better idea. Now, if you were using the weight for age chart, that will help in the first 5 years a quick deviation. But it will not really tell what is going to happen or whether it is nutritionally sound. So that's why always. So once you have decided, once you have seen that the child is growing on that, then you can be happy with the weight the child is gaining. Otherwise, you have to make sure that the weight chart is used for the quick screening because it is actually used for the midwives in the field. Any slight deviation that will show first because I told you length will take a long time to show a difference and definitely downward trend will not be shown. Whereas weight will show downward as well as upward. And then the weight for length chart or the weight for height chart will also not show a thing quickly. So the quick detection in the vulnerable age group of 1 to 5 or less than 5 years, the weight for age is the best chart. But you can't make final conclusions based on the weight for age chart without putting onto the weight for height or weight for length chart and see whether the body is putting on weight in proportion to the length or not. So same way, in the old age group, you have to measure the weight and immediately you have to put it on the BMI and chart and see whether it is acceptable or not. So I hope you have understood that. So this is the weight velocity, height velocity. Any questions on that? Do you all have any questions? නැද්ද කවුරුවත්?
No, sir.
So, are there any questions?
No, sir. Yeah.
Okay. Yeah, so the interpretation. So the interpretation is comment on the now when you see point A and B, what do you think? Can you quickly tell me? Are you happy with point A, point B? Quickly, anybody, please. Now, point B seems to be less than because usually in these charts, any parameter less than -2 standard deviation, we actually take at the face value little bit abnormal. Anything between -2 to +2, we take it as a normal value. But of course, having said that, I told you we need to know what has happened in the past. Now you can see A, although it is in the designated normal area, he actually could have been somewhere here, 9.5 kilograms. But he has lost weight. And although looking at this point and marking, we say this child is normal, not knowing about the past, that means the child had been kept on faltering. So that is not good. So at least you should know if somebody does not come with the chart, you measure this point, you have to at least ask what had been the birth weight. Then because you may have a set of charts, they may remember the birth weight, so you can see where the child can grow. Okay, the birth weight is 3.8, current weight is 7 point whatever. So then when you put the 2 points, you can say, okay, the child is here, but actually he seems to be able to grow here. So you can have to investigate. But if this child is although small, when you put the birth weight, his birth has also been small. So, but he had kept on growing. So then you have to find out why this child became a 2 kilogram weighing baby at birth. And then, okay, this child has small mother, small father. The mother also had some illness during. The child is also having some long illness. Okay, then this weight gain is satisfactory. So what I want to highlight is that a single point weight is not going to be informative, and you may draw wrong conclusions because this one you will let go and say, all right, this baby is good, and he will end up somewhere here. And this baby you will say, okay, not good. You will keep on feeding him an extra, and he will end up here becoming obese. So this one will become obese. This one will become underweight further and further if you did not know what the individual's ability to grow. So that the important thing is that you have to see the growth trajectory, this growth pattern, and then address that. So cross-sectional data is not satisfactory. So similarly, a preterm baby who was preterm, actually, if the baby was 2 months preterm, if you take them back, then of course you can see that they would be growing more or less in a correct trajectory. So you have to correct the prematurity for the growth. So as I told you earlier also, these are the charts, and there can be ones going up also. So it is interpreting the trend of the growth before making comments, as I told you earlier. So this we have discussed earlier also, just to catch it up. And then what is the most important is, now you all know, we discussed at the infant and young child feeding lecture also that we go on exclusive breastfeeding for 6 months. Now, if we can see these two charts of exclusive breastfed baby, we can be very happy, and then we can start only complementary feeds at 6 months of age because the child had been growing very well. So then at this point you start and you continue to grow on, the child continues to grow on that. But say at 5 months when you measure, the child's weight is here. But actually speaking, the child can be about 6.2 kilos, but he is about 5.9 kilos. Now, if you ignore this and say, okay, ask the mother to keep on continuing breastfeeding till 6 months, because exclusive breastfeeding is there, at 6 months he will be 6.1 instead of being 6.4. So you can see further and further he deviates from the able trajectory of growth. So this is what I highlighted. This is one instance where you have to start complementary feed, because you can see the mother had been feeding very nicely up to 4 months. The child had been growing very nicely. So the mother had been knowing how to feed the baby. Mother had enough amount of milk. Baby also knew how to suckle and get the maximum. But now what has happened is baby all of a sudden you can't think that the baby is not doing well. But of course, you have to take the history and see whether the baby develop any illness like a diarrhea or respiratory tract infection or something and happen this. But if nothing has happened, baby and mother are perfectly doing the job at same way they used to do, then of course this is the earliest sign mother's milk is not supporting and that energy deficit is now coming up. So similarly, 4 months also this could happen. And when you measure at 4 months, if they are less, then of course you have to start complementary feeding. So that's why I said the 4 month, 5 month, 6 month measurements are very, very important. So a child will not grow long on a line, but he will have ups and downs as far as the child grows within a accepted one standard deviation line that is acceptable. Sometimes breastfed babies also can grow up like this because I told you they are drinking milk on a reflex. They just keep on suckling. So, but later on, they will be able to control and then they will get back to their original matching the birth center. Discuss that. Now, the other important thing is, I told you, now, if a child weight goes down into the lower 7, then of course, always it has to be considered as a pathological thing and selected, unless the child had been growing at a very higher centile and trying to gain back its normal length or normal weight and now losing its obesity state and coming back to normal. But a normal baby who was growing on a reasonable standard deviation line, deviating downwards is always considered abnormal. Now the same thing could happen the other way around. Now you can see this child who was born with a small weight, keep on gaining upwards, going. He crosses one line here, second line, third line, fourth line here. Now, similarly, there is another baby who was born on the +2 line, going up, slightly cutting and going up here. Now, all these are going, you can see, gaining weight more than the pattern of the lines. Now, you can see these lines are going in a curve way, where because the velocity is gradually coming down. Now, this one is going almost vertically up. Now, is this abnormal or whether this is normal? If it is abnormal, is it obesity? Then, because even in the younger age, you have to correct that very quickly because obesity is putting large amounts of excess fat. It is not a normal process. So, if they are putting large amounts of fat, then you have to correct it. So, how do you correct it is the thing, or whether first of all, you have to identify whether this is abnormal or not. Right? For that, what you have to do is you have to then match it with the height. That's why I always told you whether if it is a person who is gaining weight, we have to see whether it is matching with the height. Because I told you gaining in the weight could be putting on muscle or could be laying more bones and getting in length. And then they are putting on more and more length. So then putting on length means that they are gaining length, and if length is also gained, that means they are matching their weight for the height or the length. So what you have to do is you have to transform, you have to get immediately the length also measured, and then you see what is the weight for the height or what is the weight for the length of this child. So you can see now you have got the height also measured, and you can see the height of the two individuals. So the height of this child also had kept on crossing upwards, whereas height of this child had been growing on the +2 standard deviation. Now, if you take the blue one, you can see that his height is high, and then the weight is also high. So he has gone beyond this +2 standard deviation and become overweight. Although the weight was crossing almost only one line. Whereas in this child, his length also was crossing similarly. Started in the -3, went on -2, -1, then come into the median. So then you plot it, you can see he is between -1 to +2 or within -2 to +2 range. So he's in the normal. So if you said this child was getting crossing 4 lines and he is becoming obese and cut down the calories, we will be stopping his height growth also. And that is not fair by that child. Whereas this child, if you said, okay, you have cost only one, no harm, you just continue the feeding, then this child will end up going further and further up. And already he is overweight, he will at the next 2-3 months' time, he will become obese. So that is why it is very, very important that once you have done the weight and weight any deviation, you have to correct it. Now what you have to do is you put it on the weight for length chart, you get the height or the length measure, you put it on the length chart, weight for length chart and see where are these people. So now you can see the green line is in the correct level, blue line is in the wrong level. So what is the advice that you would give? You would say, okay, this child, if he continues to grow on this line, seems to be that he's having the optimum weight and the length. Because you can see this is almost, because we ideally like to have weight for length, perfect match would be at the median. So getting more and more going up is also a little bit of dangerous. So you can tell them, okay, this would be the best line for this child, or the standard deviation between median and plus one. Now you make that judgment and tell them to monitor around this line. Whereas this child, you can say, okay, here it is not good. You come down and try to keep it between plus one and plus two. Weight for a chart, standard deviation line. So what I wanted to highlight is weight zone is something you have to get to term, but to make a conclusion, get the height for height chart. I all hello, are you all there?
Yes, sir. We couldn't hear you. The last part.
That was an internet breakdown. That's what happened. Sorry about that, the faculty. Did you hear about the oculometer?
No, sir.
So this part you are clear?
So you were explaining the second chart
Yeah.
with the length and the weight. Yeah.
Yeah. Now this part, are you all clear? Did you hear everything? Where the weight was crossing upwards, right? And then, did you all hear anything about this? Or can you,
Yes, sir. We heard explaining this
what is the message
slide.
here? Hello,
Yes, sir. Yeah.
this is okay?
Yes, sir.
Understood?
Yeah.
So when the weight is going up or whatever, you have to plot it on the weight for height chart and see where it is, and then decide whether this weight increment is favorable or not. Right? Is that okay?
Yes, sir.
Then the ochiometer. Ochiometer is where you try to measure the maturity of the pubertal growth or the maturity of the male, where you get the testicular volume measured with one index and the thumb. You palpate the testicle of one hand, and with the other hand you palpate the beads of the ochiometer and see which one
Um,
matches.
excuse
Uh,
me, sir.
yeah,
Sir, the recording is not
I know. I just
going.
recorded earlier recorded. That's why. Right. Okay.
Okay.
Oops. 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 So went into the wrong place. Right. So this will measure the volume of the testicle, and the prepubertal volume is less than 3. Peripubertal is 4 to 12, and then adult is ranging from 15 to 25. So that way, you will measure and make an assessment of the maturity of the boy. Then there are definitions of what we call ages. Now, what we usually call is the chronological age. That is from the day we are born to this world, we take the day 0, and then from that point onwards, we give. So that is the chronological law based on the calendar time. But then we also can measure or give a height or weight age to the individual. That is, when there is now a certain individual is of a certain height. So we will see this height matches at what the median height at what age. For example, now if we say a 5-year-old child is 100 centimeters, but actually 100 centimeter median is at 4 years. So although the child is chronologically 5 years, his height age or the height reaching the median value is at 4 years. So his height age is 4 years. So like that, we can tell the weight also. If the weight is 20 kilograms, but he's now, we'll say he's 3 years, he's 20 kilograms, but actually a 20 kilogram would be in a 5-year-old child's median. So although the child is 3 years in chronological age, he has put on a lot of weight. So his weight is actually having a advance. In other words, he is matching a 5-year-old child's median weight. So we can say his weight age is 5 years. So even, that even people say, okay, although this child is 10 years, he looks like a 12-year-old child. So like that, in normal, in the society also, we talk like that. So in scientific terms, in growth terms, we put it at to the median, where at least the middle number or the 50% of the population is at that level. We take that age as the reference age and give the height age. So similarly, you give for the skeletal age as well. So average age within the normal population to which the body develops is called the given. So, and in other words, there may be a 10-year-old boy who is having his bones matured to match only a 8-year-old child. So then we will call, okay, this child is although 10 years in chronological age, his bone age is retarded, or his bone age is matching only to a 8-year-old child. So that way we will have more time for him to grow. So like that, we will give the definition of a particular age in relation to the 50th centile or the median of the population. Similarly, you will have dental ages. So that is how for forensic you will learn how we estimate the age of a child. Sometimes there may be children brought without a birth certificate, and then you can do the assessment based on the dental age to some extent, or a dead body of a child. So like that you can make that assessment. So how do we do that? Is the simple way is up to about 12 years of age, we take an X-ray of the hand, and there are 20 bones which is we use. The 2 distal end of the long bones. Then instead of 8, we take the 7, not the pisiform bone. Then we take 1, 3, and 5 digits. The 1, first, third, and 5th, first, third, and fifth metacarpals, and then the phalanges of the first and third and the fifth fingers. So you can see there will be 2, 7, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. So altogether there are 20 bones in the hand, and usually we take the non-dominant hand, the left hand, and then take the X-ray. Then what they do is the radiologist will match this with pictures in a book, what is called, they have made atlases where they have taken X-rays of different maturities, and then they will match with the best X-ray, and they will say, okay, this X-ray, although you have given a 10-year-old child's X-ray, this matches with a 7-year-old child's X-ray. So they will say the X-ray is the bone age is 7 years, or the bone age is retarded. So that way we will get an idea about the bone age. Similarly, it can be, we were talking about sex hormone excess. So their bone age will be advanced. So they will be maturing faster. So a 10-year-old boy who has gone into precocious puberty will have a bone age of 12 years because his now height is also matured, his bones are also matured, and they will stop growing. So like that, you will be able to identify which way it is. So once we have got that, we have to mark it on the chart. So we use the same growth chart, the height chart, and mark it on the height chart. You can see this would be a normal height for age. Now, a child who is at 9 years was having 115 centimeters, then 13 years and 3 months was something like this. Like that you can have, and you have the length or the height distance chart drawn on this. Now at each point we can draw the bone age and see. So we have done at this point. Now at 9 years we did the X-ray and bone age assessment. So although 9 years, then what you do is for the height. Now he was 115 centimeters. The bone age was given as 6.5 years. So you drop a line here and say, okay, or you mark it here. Although the child is this much in 9 years and 3 months, his bone age is actually 6 years and 6 months. So you will mark it. So you mark the bone age, the age given against the height of the individual. So you can have against the height, 2 ages are now plotted. Although the child is 115 centimeters and chronologically he is 9 years, but bone age wise he is actually 6.5 years. So similarly, for this also you can see the same thing is happening, or at the same thing. So at 13 years 3 months, the height had been 135 centimeters. when the bone age was. Now at this point, remember, we send him to get the bone age assessed. But the bone age came as he is only 10.5 months bone maturation. So you can see, usually most of the short statures, you will see that the child is having a growth of this, or growing at having a early bone maturation. So similarly, you can see that at this age also, when it was done at 14.5 years, his bone age has been only 12 years. So you can see, you can put a marking here for the bone age, and you usually put a cross various ways you can put. So then you will have the chronological age at one point, and then the bone age at one point. So you can have actually only written this line showing the two connections. So always remember, the length measurement is the actual point of in life, because that is the real point. This is the artificial point which was brought about by the maturation. So if you see a length drawn or the height drawn, that is the real life or the real situation where we are, and this is the artificial. This is the situation created by the bone age maturity. So if you take the tall stature person, I hope you can see the same way, that there is a length occurring, the height at 9.5 years or 9 years 3 months had been 154 centimeters. At 10.5, it had been 160. Then when you get the bone age, when you send the bone age at this point, you can see the bone age has got advanced. Although the child is 9 years plus, he is actually showing 10-year plus bone age. Similarly, this child who was about 10.5 years at that point, his bone age has got matured into 12 years plus. So similarly, 13.5-year-old child is now showing a bone age of about a 15-year-old child. So his height is tall and his bones are matured that much. So that is where. So again, this is the real time point, and we are talking something about future, that is for the bone maturity. Although we are here, his bones have grown beyond that point up to 10 years plus. So this is what you have to remember for the chart. So you may be getting a chart of this, and where this chart touches and comes to the height line is the point where the measurement was really done. And related to that, along the same height line, what you get a point is the bone age. Sometimes this line may not be there. We'll put just a line there. So you will have 2 points like this, and the growth chart going on like this. So similarly here also you will have a mark here and a mark here. So when there is a mark just only in air without a line drawn, that is the bone age mark, whereas the line drawn is the height age mark. So that, or the height mark, that for the chronological age. Is that clear? Are you all clear what I said?
Yes, sir.
Right. I think this hopefully should be able to upload. And then any other questions? If you all have any questions, you can post it later on. Okay. Right. Thank you. So we'll stop it here then.
Okay, thank you, sir.